Hi guys, I'm Dr. Dadvand. I'm a board-certified plastic surgeon here in Beverly Hills, and I focus on gynecomastia surgery. And today I want to do a case study on a grade 2 gynecomastia patient. So I wanted to do this case because this will illustrate a grade 2 gynecomastia. This patient developed his gynecomastia during his teenage years, which is very common, by the way. And so this is what he looked like when he came into my office, and this is the front view here. And you can see clearly he's got some of the hallmark signs of gynecomastia, even on the front view. And by that I mean he's got this fullness, this kind of shadowing down here under his breasts. The right side looks bigger than the left side. One of the other things that I brought up during the consultation to him in my analysis was what his thoughts were about his areola size. Because you could see here, his areolas are bordering on the large side, and we had a discussion about it. He didn't actually want to do an areola reduction, which was fine. And really, I have other videos too that you can feel free to look up with areola reductions. I did a case study recently about a patient who I did do an areola reduction, but in this case, we opted to just do the gynecomastia surgery. And so that was my analysis on the front view. What I want to show you on the oblique view is actually the severity. Here you can really see how significant his gynecomastia is. Sometimes you don't notice it from the front. When you turn to the side, you really can demonstrate it. And so here you go. This is not the right shape for a male chest. His chest should be more like this, right? And so what happens is when you have that nipple projects way too far out, it definitely will show in t-shirts. And so these guys tend to have to wear layers or dark clothes to camouflage their chests. And so here we go again on the profile view, and you can see now like how far out his chest actually sticks out. His nipple shouldn't be sticking out this far. If I draw a line straight down, it's coming really up to where his belly is. And remember that for when I show you the after photos, where his nipple is in relationship to his abdomen. So here we are now with the photos of before surgery and then a year after surgery. And so I'm going to zoom in here on the front view just to refresh your memories here. This is his chest before. This is his chest now on the front view after. And what you can see is, first thing that stands out, the areolas actually did get smaller and a little bit darker, and that tends to happen with gynecomastia surgery. Now, I don't have any control over how much smaller and darker they get in these cases, but you can imagine if you had a balloon and you blew it up after you colored it with a Sharpie, it's gonna look lighter, and then when you deflate it, it looks darker. So removing this tissue is kind of like deflating that balloon. The areola gets a little bit darker. But you can see his areola is still a little bit large, but it did shrink compared to the before. Now, what I really want to show you guys is this oblique view, because this was the main gynecomastia problem that he was having, this coning out. And here you can see 1 year later, that chest contour is so good. Look at this, it just follows the shape of his pec. No more tissue hanging out there. And one thing I want to show you, when I do my initial analysis, I look at the angle that the chest makes with the abdomen, and you can see that angle in this guy, it's about 120 degrees. Look at the after. That's about 160, 70 degrees, and that's perfect. That's the angle that I want to see with these surgeries. And remember on the front view or on the side view I showed in the before, when I drew that line down from the nipple, it hits his belly. Now look, it's well behind his belly, and that's what we want. We want that deep projection. And so this was a case where I just removed the tissue, didn't do an areola reduction, but he got a great result. And what's more important is he doesn't look like he even ever had any surgery. I'm going to zoom in on his after again. And I challenge you guys to see where that scar is. Where's that scar? It's a combination of perfect placement, perfect closure, not just that. It's got a little bit of hair that kind of hides it as well, but he did really well with this. The incisions healed great, his contours are great, and he's thrilled with his results, can go on with the rest of his life, no worries. So the main reason why I wanted to demonstrate this case study was not just to show how good the gynecomastia surgery could be, but also that one thing that could bother one patient may not bother another patient. In the analysis, I talked to him about his areola size. It didn't bother him. So I always say, if it doesn't bother you, it doesn't bother me. And there was no reason to put him through more procedures to make an areola smaller. There could be another patient that has the same exact areola size and it really bothers them. These are the options you have as patients as long as you go to an experienced surgeon who knows how to do these cases. And so I hope that was helpful for you guys. If you like this kind of content, be sure to subscribe. Until next time, guys.